Welcome back, everybody. I'm with Mitchell again.
Again? Yeah,
He's
again.
he hasn't fallen asleep yet, so
I'm still awake. We're recording. It's 4 a.m. in the morning, right?
it's 4
We're
a.m.
here. We're talking. I'm in Antarctica doing a research study on cell-based nuclei and how they propagate within the medium. Just very interesting research. But I'm
Very
just
fun.
kidding. Welcome back, everyone. Welcome back to getting that medical degree. Welcome back to our channel. And today's topic, we're going to talk about a little bit of Zach's expertise, the thyroid, and everything in this section of videos of
Yeah.
studying with us, and
Yeah.
where Zach actually tells you more what to look for and what to study when it comes to specific topics. So, Zach, take it on.
Yeah, so this is for the Naplex, which is the pharmacy board exam that I'm studying for right now. My exam's scheduled for October or something, so yeah, it's coming up soon. But these are like the key ideas from each chapter, and we'll be going through pretty much every chapter in the RX prep book, taking out the key points and just highlighting some things for you guys. So the thyroid. So first things up is hypothyroid, which means your thyroid's not working as well. Hypo meaning underperforming, and hyper meaning overperforming. You really need to know those key words, hypo and hyper, for pretty much every disease state, because there should be hyperkalemia and stuff like that. So, anyways, your lab. So if you're doing a lab with someone and you see a low T4 but a high TSH. So what's TSH, Mitchell?
Hello?
Hello. Do you know what high TSH means or what TSH is?
The thyroid stimulating hormone?
Yep. Yep. That should be on your MCAT. I hope so. So if the thyroid stimulating hormone is high, your body is making that hormone because your thyroid's not working as well. So your body's trying to make that hormone to try to get your body to make your thyroid work better. It's kind of why that hormone's high. But if you have a low T4, high TSH, you're gonna have signs and symptoms. So you're gonna be intolerant to the cold. You're gonna be fatigued. You have some cramps, some constipation, some weight gain. You're gonna have some bradycardia, so your heart rate's gonna be pretty low. And you're on a goiter. So a goiter is kind of like a swollen neck kind of type thing. Hashimoto is the most common type. This is where the antibodies actually attack your thyroid and kind of like destroy it, kind of. So Hashimoto is hypothyroidism. Just remember that. That's probably gonna be a question somewhere. This is a very small chapter in the RX prep book, so you might have like one question on thyroid. So it could be something as signs and symptoms, or what's the most common type of hypo? It's Hashimoto's. Myxedemia coma, I probably butchered that word, is also a life-threatening emergency with this hypothyroidism, and for that you want to give IV levofloxacin, which is a quinolone drug class. You want to monitor the TSH every 4 to 6 weeks. So main things from here: labs, labs, low T4, high TSH. Signs and symptoms: basically your body's working really slow. I like to say it. So you're gonna gain weight, you're gonna be cold intolerant, you're not gonna be feeling well, and your bradycardia. And Hashimoto, remember that. Hashimoto, hypothyroidism, know it. Put it in your brain because now we're gonna the treatment for hypothyroidism. So hypothyroid treatment. You have doses at 1.6 micrograms per kilogram per day, based on the ideal body weight. Or if they have a coronary artery disease, you want to start at 12.5 to 25 micrograms per day. Kind of need to know that too. Just know that like dose change because that's something simple they could throw in there and mess you up. IV to PO, so IV is 0.75 to one dose of the oral. I honestly never seen like IV thyroid medications used, but there is IV. There is tablet colors. They could ask you like what color a tablet is, which is a really trash type of question. But here they are on the screen. I'll just read them to you real quick. So orange 25, white's 50, violet 75, olive is 88, yellow is 100, Rose is 112, brown is 125, turquoise 137, blue 150, lilac 175, pink 200, green 300. That's a lot of information just for one question. I don't know if it's worth the time to actually commit that to memory. To be honest, I'm probably not going to commit that to memory for my exam, but I want to give you that guy's information just in case you guys want to know everything you can about the thyroid. It is safe in pregnancy to use, so, but if you're using pregnancy, you increase your dose by 30 to 50%. Again, easy question because you're asking about pregnancy. They're also asking about the dose. They could be like, what's the dose for this person? Now you have to know to increase it by 30 to 50%. So, armor thyroid is T3 and T4. Liothyronine is T3. It has shorter half life and it's usually not used to cause fluctuations. Probably won't see that used. So, for hyperthyroidism, the labs are the opposite of hypothyroidism. So, T4 is high and TSH is low. Signs and symptoms, basically the opposite again. Weight loss instead of weight gain, heat intolerance instead of cold intolerance, palpitations, so your heart's beating faster instead of bradycardia, thinning of your hair, and also tremors. Your body's gonna be kind of like more stimulated with hyperthyroidism, so you're gonna be shaking maybe more. Most common type of hyperthyroidism is Graves' disease. Again, this is antibodies stimulating your thyroid gland, so instead of destroying it. The treatment for this, you can use a beta blocker, or a BB, which I like calling it, for symptom control. Since your heart's going to be beating a little faster, the beta block kind of helps slow your heart down a little bit. It can also be hepatotoxic, so that hurts your liver. It can also cause some GI upset. It takes about usually 1 to 3 months of treatment at high dose to control the symptoms. And once symptoms are kind of controlled, you can kind of reduce your dose. So there's two kind of things you can do. So methimazole is actually the drug of choice for hyperthyroidism. That's usually used in the second and third trimester as well. It can cause drug-induced lupus, DILE, but PTU can also be used. So black box warning, or BBW, as we talked about in one of the other videos, what that meant. Severe liver injury, acute liver failure. It's also preferred in the first trimester of pregnancy. So if someone's pregnant, you figure out what trimester and then figure out what drug to give them. So first trimester is PTU, second and third is methimazole. Now there is a thing called thyroid storm. So this is signs and symptoms. This is a fever of 103, tachypnea, cardia, dehydrated sweating, delirium, psychosis, and a coma. So this is usually done with a loading dose of PTU, then followed by every 4 hours of 250. They usually use a SSKI or like iodine thing as well, a beta blocker, also Decadron. I honestly don't know if they're actually going to ask you this on the test. This is like very like detailed, and this is a base competency test. But they might ask you what drug to use, which stage of pregnancy, just because that's. Can you use a drug in pregnancy? Yes. Which one do you use? PTU first trimester, methimazole second or third. That's what I could see being asked, or like how you treat it generally. So I do hope you guys learned something from this video. It's pretty short, I think, but it is kind of an important chapter too. So your patients might ask you about this in practice. So, any final thoughts, Mitchell?
Oh, thank you so much, everyone, for tuning in. Um, and free to listen to this uh, many more times and put it on to X speed.
Yeah.
So thank you so much for tuning in.
Peace.
Have a good day, everybody.